The name lichen sclerosus might sound unfamiliar to many. That's because there is barely any public awareness about it. Lichen sclerosus is a skin condition affecting the vulva in women, causing severe quality of life issues sometimes. Regularly in my clinic, I see many end up misdiagnosing it as thrush or fungal infections and continue with wrong treatments for ages. In this article, I will discuss the symptoms, causes, treatments, and tips for living with lichen sclerosus and whether it is contagious in 8 clear segments. Lichen sclerosus is notorious for creating various quality of life issues for women. However, due to the confusion surrounding it, many don't get diagnosed in time. Section 1. What is lichen sclerosus? Lichen sclerosus is a chronic skin condition where the skin becomes thin and develops white patches in some areas. Conversely, the skin also becomes rough and easily crack. This condition usually affects the area around the opening of the vulva in women. However, lichen sclerosus can also occur in other parts of the body. Who gets this condition? Although it can affect women of any ages, it is more commonly seen around menopause or after. Nowadays, a type of lichen sclerosus is also appearing in younger girls. Both men and children of both sexes can develop lichen sclerosus as well, but rare. Section 2. Signs and symptoms of lichen sclerosus. Skin changes first. You might notice 2 kinds of changes overall. In some cases, the skin becomes excessively thin and smooth, making it prone to easy tearing. There can also be white patches. On the flip side, the skin might become rough and wrinkled, leading to cracks in the folds. What symptoms may occur? Persistent itching that does not go away even after applying medications. In more severe cases, there might be pain in the vulva, skin tears leading to bleeding, or even blisters and bruises, rarely. If you notice any bleeding due to fragile skin or persistent itching, it is crucial to see a doctor sooner rather than later. Section 3. What causes lichen sclerosus? In a nutshell, the exact cause remains a mystery to scientists. It's suspected to be an autoimmune disorder where the body's immune system inexplicably starts attacking its own skin, leading to lichen sclerosus. It was previously believed that hormonal imbalance might also be a cause. Might be a family history, though this condition can develop even without it. Past skin trauma or repeated chronic infections can also sometimes trigger or lead to development of lichen sclerosus in future. These are all still in the realm of scientific speculations. No hypothesis has been conclusively proven yet. Section 4. Diagnosis. When should you see a doctor? If you notice any unusual changes in your skin, particularly persistent itching that won't go away or even slightest bleeding, it is essential to consult a doctor right away. Medical examination. The doctor will examine the area either with the naked eye or using a magnifying glass known as vulvoscope. Biopsy. While not always necessary in cases where the diagnosis is tricky, a biopsy is the wise choice to confirm lichen sclerosus. Many other skin issues can mimic the white patches of lichen sclerosus. Diagnosing these without a biopsy can be quite challenging. Section 5. Treatment options. First, steroid ointments. Local steroid ointments can help to temporarily reduce the immune system's overreaction to the skin, allowing some of the skin changes to return to normal. Although lichen sclerosus is a chronic condition, it is important not to expect it to be cured with just one round of medication. However, relief can last for days, months, or even years in some cases. This is called remission. Steroids help to reduce local inflammation and itching. These are generally highly potent group of steroids. Other medications besides steroids. When steroids don't work or if the use is problematic, immune modulating creams can be of use. These creams are not yet readily available in India. Regular monitoring. Monitoring is a significant part of the treatment. Regular skin monitoring over several years is necessary to detect any progression to more complex problem and to initiate additional treatment as needed. Surgery. Surgery is generally not required. In some uncommon cases where medications are not working at all, surgery might be necessary. Section 6. Living with lichen sclerosus. This condition is long term, so it's essential to know how to live well with it, the strategies of it. First, skin care tips. Avoid soaps. Instead of soap, use emollients recommended by your doctor. They can be used just like soap and will leave you feel clean with regular use. Do not use over-the-counter vaginal wash. Moisturizers. Regularly apply specific moisturizers prescribed by your doctor to relieve the symptoms. These keep the skin soft and supple. There are barrier creams that protect the skin from external water or chemicals, reducing irritation. Some of them are a combination of various paraffins. Proper clothing, very important. Wear cotton undergarment. Make sure your clothes are a little bit loose. Over time, cotton undergarments can become stiff. Still use cotton ones that you can change every few months. Use only non-organic detergents for washing clothes. Avoid Dettol or Savlon. We have a vulval care leaflet. If you wish to have that in your mailbox, please fill out the form below. I will be happy to send it via email. Next, sexual health tips. Openly discuss with your partner. Don't hide out in fear if needed. Bring your partners along for a visit to the doctor. Listen to and learn all the answers to your questions together. Lubrication. Some patients prefer using lubrication during sexual activities. Use a lubricant recommended by your doctor only, as not all lubricant gel might be suitable to you. Emotional management tips. Very important. Don't fear the condition itself. Rather, fear not getting diagnosed. Lichen sclerosus is not very common, and even when it is, women might not feel comfortable discussing it due to social taboos. Get fully informed about it through your doctor's advice. This will alleviate your fear of the unknown and help you manage it better. In some places abroad, groups of lichen sclerosus have been formed where affected women have created societies. You can search on Google and become a member of these international societies too. For the 2025 World Lichen Sclerosus Awareness Day, 4 NHS trusts in England, that means the hospitals over there, have collaborated to create a valuable online resource, www.lichensclerosusguide.org.uk. You can read through this website from anywhere in the world. Section 7. Answer to some common questions. Is lichen sclerosus contagious? No. There is no fear of spreading lichen sclerosus from one person to another. It is not even related to infections. Can lichen sclerosus cause cancer? Well, most patients with lichen sclerosus will not develop cancer. However, there is ever so much a slight increased risk of vulval cancer in some patients. Regular checkups can help catch any issues early on. Can men get lichen sclerosus? This condition is quite rare in men. However, a specific type of lichen sclerosus can occur in both boys and girls. Section 8. How to prevent it. Regular checkups are absolutely necessary. These should be done with the doctor. You can also check your vulva yourself by lounging on a sofa on a brightly lit room and using a small concave mirror. The kind of mirror used for makeup or shaving. These are easily available in the market. You can just buy it and look after yourself. Proper skin maintenance is very important. Avoid damaging your skin by constant scratching. Follow your doctor's advice and properly treat your skin during flare-ups to minimize trauma. Keep your fingernails trimmed short to reduce the risk of skin damage and infection. Above all, focus on a balanced diet. Certain foods can worsen lichen sclerosus symptoms. Try to maintain a food diary to identify those foods. You can avoid them in future. How to maintain a balanced diet? We have 2 special articles about diet, part 1 and part 2. Links are below. So, in this article, you should have learned comprehensive answers to all the necessary questions. What lichen sclerosus is, symptoms, causes, diagnosis, treatment options, and whether it is contagious or not. Awareness is crucial for accurate diagnosis and effective management. We hope this article will help make your journey with lichen sclerosus easier and more confident. Remember, regular checkups and proper skincare are the best ways to manage this chronic condition. Stay informed, stay healthy, and don't hesitate to consult a doctor if you notice any unusual changes. If you have any further questions, feel free to leave a comment below. I'll be happy to answer. Take care and see you soon over another video research article.